the trust that you have given me and that I think that we're continuing to earn in the practice is everything. So to that end, and in order to sort of increase the reach that we can have, I brought Alexis into the practice. I want to tell you a little bit about Alexis. She is so interesting and so cool. And when we first met, I think we both we really recognized something in each other that was really important and special. And that was not only the way we came into our medical practices and how we allowed things to evolve organically, but our devotion to having a little bit more curiosity, humility, and depth in our toolkit and bringing that to you as partners in your health. So I'm going to tell you a little bit about Alexis. She comes to us from originally a bachelor's in history, which I think is really interesting because I think it's important when you have a liberal arts background, you think critically about things in a different way. Then she trained and got her master's in nutrition. She did a Harvard post-bac, and she also got her master's as a physician's assistant, or now what we call a physician's associate. She's worked at New York Presbyterian Weill Cornell in New York, originally as a dietitian. She's also been at Beth Israel Mount Sinai, and then she came to Los Angeles where she worked at UCLA. She's worked at NERPS. She's worked at WISC. She's had a really broad, interesting career path. And she's really interested in root cause and complex recurrent issues. We'll get into that in a little bit. And she's working with me to really fully appreciate perimenopause and menopause. I'm personally training her, and she's also being trained by a nationally recognized training program. So the first thing I want to talk about with you is what drew you to this kind of model of care? Like, how do you approach care? What drew you to this?
So I think for me, as I'm sure many women can relate to, the healthcare system has changed dramatically over the years. And I think we are finding that women are just feeling like they're going into offices and they're not getting the full picture, and they're just going in for that, that main issue, and a medication is sort of being slapped on them, and then they're going home, and they're not really understanding sort of what's going on in just the comprehensive view of everything. And so I think what this practice brings that is so unique is really just time. Time with our patients. We want to make sure that we have the ability to really understand the root cause of what's going on, what the main issues are, and sort of zooming out and looking at so many different factors. And I think this model really allows for that. And so for me, what drew me obviously is you, because you're incredible, so accomplished and so well studied, and just you have so much information to share, and I'm so excited to learn from that. But also just the idea that women need to feel seen and understood, and that's what this model is going to bring. And I'm sure you've felt it too in your previous roles, but you hit a limit where you just feel like you can't give the patients the care that they need. And I think this is going to be really different.
Yeah. And that has been in the short time. I mean, it's been a fast year and a half, but in the short time that we've been open, that has been the biggest difference that I've seen. And it's funny, and I bet you feel similarly, but I always felt like I knew my patients, and I think I did know my patients, but I really know my patients now. Like when you sit with somebody for an hour and your follow-up with them is a full 25 minutes, you really know what's going on with them. So I'm excited for you to have this experience. And I think I think the fact that you've had more than one kind of in-depth, not just clinical training, but patient experience, really, you bring a lot to the table, right? You really understand, people throw around the term lifestyle all the time, but even though you're not acting as a dietitian here, you have actual training in that, which gives you a very different perspective on the information that's coming from the patient, from the person kind of sitting across from you. So, I mean, one of the other things I want to talk about, because it brings this specific word, integration, which is another word we use a lot. What does that even mean, right? But how would you explain that term, what it means for our patients?
Yeah, I mean, I think integrative medicine is actually slightly misunderstood. I don't think you have to have integrative or Western medicine. I actually think integrative is thinking about the combination of the whole picture as well as the best Western medicine care. And so really it's just the marrying of those two concepts.
Yeah.
So for me, integrative obviously is just looking at the 360, the lifestyle, the stress, your work life, your relationships, and how that impacts your day to day, and how that impacts your health, because it is all connected. It's really hard to sort of hone in on a patient's issue and say, oh, okay, you have this infection, I'm just going to treat that infection, and then not look beyond that. And so I think integrative is really like removing that silo and just kind of stepping outwards and looking at what else is going on in the patient. And really just knowing that you're gonna get the best of both here, really. It's not that we're only integrative, we're gonna incorporate evidence-based, but then also look at holistically at our patient.
Yeah, and that's really important. And to me, that is really truly the definition of integration. I shared that with you, and that was one of the things that I think drew us to each other, because we are looking at the current science, what's evolving, what's evidence-based. Sometimes, we don't have the evidence we want. We'll find the evidence we need. And the evidence is also your experience, honestly, like the feedback that we're getting from the patient. But when you can plug that into the person's whole life and experience, it makes for a much more in-depth relationship, and also a better opportunity to really figure out what the problem is and how to approach it. And that kind of brings me to some of the stuff that you do that you're really kind of, you're known, okay? You're a thing, like you're known in the community for dealing with stuff that is harder to deal with. So I kind of want to talk about that. Let's dial it back a little bit though and talk about like some actual day-to-day care examples. So I work a lot with perimenopause and menopause, and I specifically find that I like to dig into metabolic health, prevention, sleep, mood, libido. Obviously, I'm using hormones when appropriate, but I do a lot of lifestyle-based medicine. And the interesting thing for me is that when I moved into this practice, I really got fully into metabolic health in a way that I never thought that I would. Like because I didn't have time. So just having the body composition scale and adding a couple of key labs to the labs that I do for my patients. And then actually, like you said, having the time to look thoroughly at those labs and put together with the body composition scale. And where are you now? And where do you hope to be? Like those are some of the things that I've been able to do. And it's not, like you said, it's not siloed. It's not like, oh, you all may not realize this, but when you come in, you make an appointment for, for your practitioner, like there's a chief complaint assigned. I think maybe we need to get into some sausage factory stuff with them, because I don't think that they realize that like you make that appointment and like, this is what we're going to talk about. That's, by the way, why when you go see your practitioner and you really had maybe 15 to 20 minutes assigned, which probably means 7 or 8 because they're running late and they were double booked. That's why when you bring up those 5 other things that have been bothering you for 6 months that it took you to get the appointment, your practitioner is like sweating because she doesn't have time to do it all. Okay, so having gone tangential, I want to make sure people understand. Like when we have a membership and we have more time, we don't have to do that. And we get the time and the luxury of time for both you and for us to dig in and look at those connections. Like look at the connections between your lifestyle, your stress, your sleep, what you're putting in your body, and what is bothering you and what your goals are. How do we get you to where you want to be and help you stay where you want to be? So I know you have some specific things that you are really interested in and you have had the time to really dig into and are really bringing depth to this membership and to these patients. I want you to talk a little bit about that. Yeah.
So first off, I definitely want to speak to the point on what you just said about having the time. I think really what we bring here is actually like a relationship centered model.
Yeah.
the relationship that we have with the patient, which I think is incredible, which allows us to sort of look at that full picture, because the idea is that it's not just about the issue at hand, it's about understanding all the other elements of life and how that impacts, you know, the outcome, right? And so what's interesting is, so my specialty, I would say, is sexual health, and recurrent infections where, you know, you're having the same repeated issue over and over again, and you can't figure out the why behind it.
Right.
And so I think people often come to me and say, I've been to, you know, multiple doctors, I've been given the same regimen to some extent in all of their offices, but nothing is changing for me.
And this is, by the way, this is a big problem. So if this doesn't apply to you, like you have no idea. This is a lot of people, and it's obviously a horrible experience for that person, and it's a very stressful experience for the practitioner because we often don't know what to do.
Right.
So sorry, I just wanted to like let us because like she and I are talking about this and we know, but like y'all may not know.
Absolutely.
This is a thing. Yeah. Okay. Sorry.
It is a thing, and especially particularly for women of all ages, but for younger women who are sexually, you know, not that women are not sexually active at all ages, they're all active. However, for younger women who maybe are not empowered by the knowledge that they have about their bodies and their sexual health, that can be particularly intimidating for them. So if I have patients that are, you know, in their 20s and they don't really understand their physiologic discharge or the change in pH that they experience from week to week, and so that impacts, you know, how they're feeling, how they feel intimately with their partner, or how they feel day to day, like why one week are they feeling great and the next week they're not feeling great. So really, like, my specialty is taking the time to explain to patients what is going on in your body from a week to week standpoint, because no week is the same for a woman, right? You know, we're on our cycle, and each week our hormone levels are different, our pH levels are different, and so things that we might need on one week could be very different than on the third week. And so my goal is really to educate women so that they feel empowered with that information, so that when they're not feeling great, they're not questioning that. They're saying, oh, I know exactly what's going on in my body. And this is actually how I have to care for my body on this week versus a different week. So sexual health and education and understanding is a key part of the relationship that I have with my patients and what I want to inform them on, as well as just how to get to the bottom of things. You know, what's really interesting is I can have two patients come in with the exact same issue, and my treatment modalities will be completely different.
Right, of course.
Because their stress is different, their hormones are different, you know, how their lifestyle is different. So that's an element that I think women don't really understand. You know, they just think like, oh, okay, here's an issue, this is the treatment, end of story.
Right, or like my girlfriend did this.
Right, so.
I mean, and that can be a good point of entry to have a conversation, but like what she needs versus what you need may not be exactly the same. Yeah.
So I think that's the foundation of working with me is really education and understanding, and then obviously like recurrent infections, family planning, contraception, midlife health, and how that connects to our hormones and our lifestyle is something that of course overlaps and is so integrated as we age. And I think the thing that I always like to tell my patients is the relationship that you have with a gynecologist, that's the longest standing relationship you have with a clinician.
Potentially.
You like us, which I'm sure you will. But that's the longest relationship that you're gonna have with a provider. So I think about my patients as like, I'm gonna grow through like your health span with you. So that you feel confident that at every phase that you are, you know, changing through, you feel like you have someone that you feel seen by, heard by, empowered by, so that when you leave our office, you're really feeling like, I actually don't have any questions. And if I do, actually, I know I can come back there and not say anything. Yeah,
and that is one of the nice things about the membership that I found is that because I have more time and we have more time, often there aren't as many follow-up questions because people didn't feel rushed through the appointment. And then later they realized, oh, I had these 10 other questions that I wanted to address that didn't happen. But also because we have a smaller panel size, we just have more time to address these things with you all. And there's, it's easier to connect with us, you know, directly or indirectly through our amazing staff that is obsessed with and loves. So that's really exciting, and I'm really excited about what you're bringing to the practice in terms of that, because some of the stuff that you've been working with, like, you know, you kind of alluded to the microbiome and pH and how the hormones impact all of these physiologic changes in our body are really important for us to understand as clinicians and for you all to understand as the owners of that body, and just having that dedicated time and some really expert in this it's very exciting because in perimenopause, people, you know, a lot of my patients who have these problems when they're younger and sort of we got it figured out, it starts to get worse again in perimenopause and it's because of the pH changes and the estrogen changes and so
it's just another cycle of it at a different point in your life.
Yeah.
And it's really helpful for you to have the foundational understanding
Yeah.
so that as you hit the next phase, you're understanding, okay, now I understand why am I having genitourinary symptoms when, you know, I'm in my late 40s that I never had in my 30s.
Right, and not calling urgent care,
Right,
you
and
know,
just getting
every Friday night at 6 p.m. and getting antibiotics, right? Like you already know, like, oh wait, this is a thing. I remember. That's hugely important. If there's anything wrong with calling urgent care, but like that's not like a long-term strategy. I mean, you don't have to go off of it. You probably will. Okay, so what I mean, I feel like you sort of addressed this, you know, talking about how you do this a little bit differently than traditional gynecologic care. No shade to traditional gynecologic care. We love our traditional gynecologists, and she and I are both trained in traditional and conventional medicine. I feel like you kind of talked about that, like it's more in depth, it's more precision, it's more individualized.
Yeah, I mean, the thing I like to say that I think women will find very interesting is that when you are someone that has had repeated infections and you're just going back to the doctor and they're just giving you antibiotics, what ends up happening is you build a resistance to the treatment modality. And so we need to figure out like what's happening, why is this happening, and how do we best understand that. And one of the things that I think, you know, I'm known for is just the understanding of this idea of a biofilm, which is this protective layer that sits on top of the infection that bacteria love to hide in. And so when that biofilm is there, we actually can't get to the infection. So what ends up happening is you get treated with tons of antibiotics thinking that it's resolving the infection. Then you start killing off some of the wonderful good bacteria that you have in your body. Then you start having some GI issues. And so really, like, I want to take a step back. I want to look at that. I want to pull off that biofilm with a special modality that we use through a compounding pharmacy. And then once I've done that, then I can treat the infection effectively.
Yeah.
The idea is that we want to prevent the recurrence and we want to treat you long term. We don't want to just treat the symptom.
Right.
You know, we just really want to prevent you from coming back in with the same issue over and over again.
Yeah, and I love this because this to me is the practice of medicine. It's the always learning what is next that we can offer that in a really meaningful, clinically applicable way to real life patients. Like that's super exciting. I mean, we're very aligned on that. I mean, I don't know. Is there anything you think that we should address? I mean, does anybody have questions in there?
Not yet, but we're open to questions from
Yeah. If anybody has questions, please go ahead and put them in the chat. If it's something that's, you know, obviously we're not going to say who you are. I think just kind of nuts and bolts stuff, understanding. You know, obviously I'm still in practice. I'm here as a person to mentor and bounce ideas off of, and I plan on doing the same thing, which is what's awesome about having another practitioner in the practice. People who are signing up with Alexis are Alexis's members and Alexis's patients. So they're having indirect access to me, but they are fully owned by the amazing Alexis. I think you already see what you're getting. You're getting something pretty special and comprehensive. And I'm excited about us learning together and, you know, maybe working on how do we create more protocols that can be beneficial to our patients over time, because two brains are always better than one. They are not additive, they are multiplicative. Yeah. So if we don't have any questions, I think we're gonna end it here. And looking forward to hearing from all of you, from any of you.
Oh, we have one question.
Yes, we have a question, never mind. Yeah,
A couple of questions.
yes, okay, here they come.
Do you have low accessible tables that can be transferred to? That means-
Is this like a question about making sure we're taking care of our disabled patients?
Maybe.
The
Low
tables are not low, but we do have ways of getting people assistance. I've had patients over the years in my last practice, and we have the same tables here as we had there. First of all, we have one that does go up and down. And I've had many patients over the years who are wheelchair bound and who are not able to move themselves, and transfers we're able to do that in your box, yes.
How do you help a patient who is in remission, but as stage 4 always will be on some kind of treatment, navigate big decisions like surgeries?
Okay, so I do need to be more specific, so I don't know what you're in remission from. I'm gonna assume it's an estrogen-dependent cancer or breast cancer.
Breast cancer, she said.
Yeah, breast cancer. So many of you know, so this is really, so complex cases are still gonna be managed by me. That's not really, at this point, a person with complex issues should be in my membership, not Alexis's membership, right? So this is more for me, and that's a conversation I'm happy to have. We do discovery meetings where I do a one-time consultation fee, and I invite people to come in. We have the same thing for Alexis. You can come in, meet with her for a fee that would be applied to the membership should you decide to join the membership within that month. And if it's not a fit, it's not a fit. So that's something I'm happy to talk about, and I know Alexis says as well.
That's what she wanted to know.
Yeah.
Thanks. There's another question that says, will a lot of the testing or labs you do be covered by insurance?
Great question.
Also, second question from
Yes.
this person. Also, what do we do about the estradiol patch shortage?
Oh my goodness, okay. That's its own webinar. I will answer that to the extent that I can. In terms of lab testing, anything that we are doing in the office that is outside of the membership, we always will help you try to get insurance coverage. So generally speaking, the labs are covered by your insurance. Now, I don't know what your deductible is, and you may not either, so you're gonna find out. But a practitioner does not have to be in a particular network, generally speaking, to order things like mammograms, bone densities, anything that would be covered by your insurance. And so our staff is here to help you assess that, and we also can help produce super bills so that you can get some compensation or reimbursement for some of your visits. Again, don't forget, you probably have a deductible. So, right, and I will say, even though that's not what this is about, I, for myself and for my staff this year, have a plan where we have HSA, health savings account. I really recommend you look into that, because you can put money pre-tax away up to, I think, about $6,500, and you can use that to pay anybody for any health related activities that are not going to be covered by insurance. And that's something that I've committed to, because I seriously believe that we should be making our own choices, whether on money, and our insurance is doing what it's doing, but it is not doing preventative care. I think we all know it doesn't pay for preventative care. So hopefully that answers your question and more. In terms of the estradiol patch shortage, it's a huge problem. If you haven't read my Substack, you should be following The Modern Heretic. And the LA Times is going to be publishing an op-ed that I wrote with Jennifer Weisswolf, who is a professor of law at NYU and a big policy person, about it. It's a very complicated thing. I will say it is not our fault. It is not your fault. Less than 5% of women in the US who are eligible to use hormone replacement therapy are using it. It is not you guys asking for too much. It is a much more complicated issue. If you're having trouble filling your scripts, online pharmacies are still doing a better job, although I now heard Cost Plus is out. Amazon, I think, still has the patch. HRT Club still has the patch. There are other ways you can get your estradiol. So you may need to go from the bi-weekly patch to the weekly patch. You may need to go to a gel or a spray, compounded, oral. There's other ways to get your hormones. Talk to your practitioner, and also get loud about this, and do not be small about it, and demand change. And actually, who I think you should go to is the Federal Trade Commission. And you can read my Substack about that. Well, this went far afield.
We have just a few more
Yeah, yeah.
questions. So Alexis can also provide care for pelvic floor weakness. That's a
Mhm.
question. She mentioned that she specializes in infections and sexual health for younger women. What about pelvic floor weakness?
Yeah, so that's a very common question. Yes, I mean, we actually refer to pelvic floor therapy, but it's something that we would discuss in our consultation. So that's definitely something we see a lot of. And that
So we have the V-tone.
yes, we have the B-tone,
Yeah.
which helps strengthen that. And also, having that weak pelvic floor creates its own set of symptoms that I think many women maybe aren't always so aware of, like pain during sex or urinary issues, bladder control, etc. And so that is definitely a hot topic and something I'm very well versed in. Yeah, important.
Another question. When you order and analyze labs, is your practice geared towards optimal numbers and health versus just falling into quote unquote normal range? Do you review and help with micronutrient testing?
So we do have a micronutrient test that is available, that is not part of the membership. And because I think we are both she's more of an expert in nutrition than I am, I'm very aware. But I do have a dietitian who gets assigned to you to go over the micronutrient testing. And then if you decide you want to continue to work with one of our dietitians, then that's something that you would do on your own. But yes, we do that. And we are well aware of optimizing and not just normal. I mean, yeah. Yeah. Anything you want to close with?
I think I would just say that, I've been practicing for over 14 years and I didn't think I would find a practice that had this sort of patient-centered model. And I'm so excited to be a part of this with you. And I know that we are going to start making such tremendous changes in women's health. I think we're at the start of a movement here, and I'm just excited to be a part of that. And I feel that this is, if you want that comprehensive, relationship-based patient care, I think this is the right place to be. And I'm excited to, meet all the new patients that come through and work with you.
Yes, I couldn't have said it any better. Thrilled and honored. Excited to see you all come on through and meet Alexis and hopefully join the practice. And we're gonna close there. But feel free to reach out. I think we have all the stuff in the webinar details. Okay, great. Thank you. Take it easy. Thanks for signing in.